My next guest spent years wondering why her legs hurt so much. The cramps, the swelling, the heaviness. She wondered if this was just what aging felt like. All that changed when she met Dr. Rajiv Agarwal at Modern Heart and Vascular Institute. He made her a promise saying, "I'm not going to send you home with a pill. I'm going to find what's really wrong." Today, Barbara Barnes says that promise changed her life. She and Dr. Agarwal are here to share that story. Good morning.
Good morning.
All right, a lot of power in the words you said, "I'm not going to send you home with a pill." What you do is not address our symptoms, because oftentimes as patients we'll go, just make the symptom go away, I'll worry about the problem later. The problem marches on. What you all do is let's get to the root of the problem.
Right, a lot of people have symptoms that are ignored for years, and they take pills, they put ointments on their legs, and really what they need is to fix the root cause of the problem.
Yeah, and what I find is a lot of people still go to the wrong doctor. I've told you before, I had a family member who was looking at it as an aesthetic issue. When you're looking at her leg, it's like, that doesn't look like an aesthetic issue. And she goes, well, I'll just go to my dermatologist. Or is it a muscular issue? And really is something that lies beneath, and that's where vein care matters.
Right, even my mom, she was put on 2 medications for neuropathy. And then she told me her legs were bothering her, and we fixed her veins. And that was 9 years ago, and she came off of both medications and dances around now.
Yeah, well, okay. All right, vein disease. What are some of the symptoms that people might recognize? We mentioned a couple of them.
Yeah, so the main symptom, a lot of people, is just pain. They get cramps, they can't sleep well at night, they can get swelling, you can see varicose veins. Sometimes you see some color changes, and you can't ignore those.
Yeah, and then sometimes we've seen people where it almost looks like almost an ulcer when it's gone that far, right?
Yeah, and those ulcers, if there's color change on the legs, it's very advanced disease already. Wow. So they need to get help right away.
All right, Barbara, when we talk about pain, people go, okay, people have some pain, people have some leg cramps. We're talking something that you would just wake up screaming in the middle of the night.
Exactly. You're sleeping, you have these horrible pains. You go to grab your legs, try to stand, get out of bed, and your other leg cramps. Wow. So you can't walk, you can't stand, you're just there screaming.
Yeah.
You're
immobile.
Yeah. And it's, wow. Then your legs get heavy, right? You have your swelling, and you're there for about anywhere between 3 to 5 minutes, as I can recall. In pain. Wow. And all you can do is just hold on, stand there, or just lie in your bed. That's it.
That's the kind of impact. Your whole quality of life
Yes.
has gone there. And at what point did you say, okay, this cannot be a part of normal aging? First of all, you look too young to be talking about normal aging. But at what point did you say, okay, this is not a part of normal aging? Somebody needs to help me?
Well, you know what? It started out some years before I met Dr. Agarwal. I did see other specialists, and they just gave me a diuretic and said, you know, the swelling would go away, and try walking. That didn't work for me. So I was referred over by my PCP to Dr. Agarwal, and I had to go back, and I was telling him about my legs. And he said to me, "I promise you I will not give you a pill and send you home." And he did that. And I feel amazing, just amazing today, yeah.
All right, for the treatment experience, there are also some people who remember their parents or grandparents going through this process with their veins. It was called vein stripping, which was very aggressive. And I had people say, I'd rather deal with what I'm dealing with right now than do vein stripping. We don't have to do that today. That's not what you were doing. That's the whole point between Modern Heart and Vascular.
Right, so no surgeries. Actually, we have people who come in from work, get the procedure done, and go back to work immediately. So it's completely minimally invasive. Basically, you're just putting in an IV.
Yeah. No, I know some of your patients who have come in from work and called and said, I can't come in for the rest of the day, and they're out the mall shopping. That's how good it is. And even actually deciphering whether someone has vein disease. First of all, you need to know what the problem is, right? Right.
So we have a very thorough talk with them to try to decipher what the real issue is. We examine their legs very thoroughly, and then usually we'll get an ultrasound to clinch the diagnosis.
Yeah, and that's very easy to do, non-invasive, yeah. All right, how has life been since your treatment?
Oh, well, amazing. No cramps, no swelling, no heaviness. My activities is back to normal. I feel amazing.
Wow, okay, what did you do with her?
Well, she had a few procedures to close her diseased veins. So the basic problem is blood's going down to the foot, but it's not coming back properly. So you got to close the diseased veins that have the blood going in the wrong ones. So you close those, the blood automatically moves to the good veins, and those symptoms are gone.
Yeah,
so
and
she
we
had
have plenty of other veins. If you block up some veins, you have plenty of other veins to deal with. Yeah.
Yes.
How quickly did you notice a change?
Honestly, I told one of his staff that I felt the difference my first week back as a follow-up, because they would do one leg at a time. And it was a difference.
Wow.
Yeah.
All right. Dr. Agarwal, you are growing. You have Modern Heart, which is expanding, but Modern Heart and Vascular. But you also realize that, you know, that old song that goes, the hip bone's connected to a lot of things are connected. You may have someone who comes in who has heart disease, but they also have diabetes. So it's like, let's make sure we can manage that diabetes so the heart disease doesn't get worse, right? But so many other things that you've added to your practice to make sure that it's comprehensive.
Right. So we have tried to become a one-stop shop for our patients. When patients think that I need medical help, we want them to think of Modern. So we have primary care doctors, we have a podiatrist, we have a gynecologist starting. So really focused on prevention.
Yeah, and that chain of command, because oftentimes when you say to someone, okay, we got this problem taken care of, you probably need to go see if they don't know who that person is, or it's not under one roof, or one practice, then where are they going, right?
Right. The biggest benefit is communication. So if I'm getting blood work on somebody, everyone has access to it. So you're not getting poked multiple times and getting unnecessary testing.
All right. What do you say to somebody who's putting it off?
It's common. Don't put it off. It's a common disease. Go and have it checked and get cured.
Get your life back. All right. Don't put it off any longer. Schedule a vein evaluation with a specialist at Modern Heart and Vascular to find out what could be causing your leg pain and what can be done about it. To connect with them, visit modernheartandvascular.com or call them at this number on your screen, 832-644-8930. Again, that's 832-644-8930. They have 8 locations throughout the greater Houston area for your convenience. Get up and moving pain-free again.